A panic attack is one of the worst feelings a soldier can have. The purpose of this video clip is to teach you how to deal with them, how to recognize them, and how to make them go away forever. Interestingly enough, panic attacks often begin as if they come out of the blue with no apparent cause. There seems to be some genetic history and panic attacks tend to run in families. But we're going to teach you today exactly how to recognize what a panic attack is and how to make them go away and stay away forever. Anxiety is the same thing as fear, except that the cause of the anxiety is usually not apparent to the person suffering from it. There is a tendency to overestimate danger and underestimate one's capacity to deal with the danger. Once you've been in a dangerous situation, particularly since you've been in combat, your body has a very keenly developed sense of danger, and your body picks up on it far earlier than your brain. And so your body begins to react to a perception of danger, and then you begin to react to your body's reaction. In other words, it's a catastrophic misinterpretation of your body's normal response to stress. What we need to do is to teach you how to recognize what your body is doing and for you to become thankful for your body's early warning system and not to fight it or misunderstand it. Trauma has a way of making itself remembered deep in every part of your body, particularly your muscles, your heart, and your breathing system. Many of the symptoms from a panic attack come from hyperventilation. That means breathing faster and more shallow than normal, and the funny part of it is the soldier is not aware of that feeling of hyperventilation. But what happens is they sense some nervousness in general, a tremendous sense that catastrophe is going to happen. There may be numbness and tingling in the fingers and toes and numbness in the lips. There may be feeling that you're going to faint, and there's a strong urgency to leave the scene, to get out of the situation as soon as possible. What you want to do, though, is to stay with it and let it run its course and not to overreact to these symptoms. A panic attack is harmless, and for healthy soldiers, it has no bad effects on your body or on your mind. Panic attacks will not make you go crazy. Panic attacks will not kill you. And the more panic attacks you can have, the better off you are, because you're going to learn that panic attacks are nothing more than telling yourself ghost stories. You're frightening yourself by misunderstanding your body's superb response to stress. Each person seems to have a unique way of reacting to stress, and they have their own body language to interpret it. Some person might notice that they have a funny feeling of the hairs on the back of the neck standing up, and for them that means the beginning of a panic attack. Other people may have a queasy feeling in the stomach, or some person might feel there's a tremendous weight on the chest. These symptoms usually last no more than a few minutes. If they last for hours, you need to get to the emergency room right away so you can be brought down with medications. The bottom line is not to worry about panic attacks. Panic attacks are in some ways life-saving. In other words, they're meant to get you out of the way of danger. The problem is that the danger is no longer occurring in the moment. It's occurring mostly in your memory, and the memory is very foggy for how this actually got started. Typically, a healthy, normal person may begin to feel in combat that their life is going to end. It may be a sense of dread. It may be a sense that, quote, today I will die, or this could happen to me. We all know what horrible feeling it is when you lose a close friend in combat or in any situation. Grief may be tied up in panic attacks. It may actually begin when there's a sudden loss of someone close to you, and the body begins to remember that situation in vivid detail. And so anything that was going on in that situation gets buried deep into the memory. For example, the time of day, the temperature, the smells, the touch, the sights. Anything that triggers this again will cause a panic attack. You may be sitting in a restaurant enjoying yourself, and all of a sudden you have a strange smell that reminds your body first, and your mind much later, that tragedy is about to happen. You may turn the table over or run out of the restaurant or actually feel like you're looking crazy in front of other people. But these are normal responses that saved your life in combat. The idea here is to realize that panic attacks are trying to teach you something. They're not dangerous. They're really quite harmless. They just scare the living hell out of you. So the next time you feel yourself beginning to have a panic attack, breathe deeply and slowly, repeatedly. If you have an opportunity to, get in front of an air conditioner or get fresh air blowing into your face and calm down your breathing. Another thing you can do is to stay physically fit. So when your body gets ready for fight or flight, you're ready to do either one. But I want you now to get ready to negotiate with these feelings, to recognize that these feelings are trying to teach you something. These feelings are not dangerous. These feelings are related to your memory. These feelings can be able to change your life in a positive way. There's nothing harmful about panic attacks. Don't be afraid of them. Have them as many as you can, because then you'll realize they're totally harmless. If you have any questions about what I've said so far, don't hesitate to contact me. You have my cell phone number. And let's get on top of these panic attacks and make them go away.